Now let's get to some of your thoughts on our big story from last night from investigative reporter Evan Watson. It was all about a law in the state of Washington called Ricky's Law, which allows for forced treatment for drug and alcohol use if a person meets strict criteria. A mental health professional decides if someone is a danger to themselves or to others' property, or gravely disabled due to a drug or alcohol problem. If so, that person is detained and taken to a secure withdrawal facility for up to 17 days. Now, the state of Oregon does not have a law that allows that. The only forced treatment option in Oregon is due to mental health issues. And Evan explored the high bar for that civil commitment in his previous series called Uncommitted. But for drugs and alcohol here, someone could be held briefly, but unless they agree to treatment, they're released. We got a number of emails and voicemails after Evan's story aired, but one of them really did stand out. This one's a little longer than what we usually play for you, but it really offers a poignant example of how something like Ricky's Law could potentially save lives here in Oregon.
This was a hard call to make, kind of, because my daughter's story models a lot of what I heard in this story, maybe even in a more severe way. She had mental illness coupled with drug addiction, and she went many years with substance abuse problems, and she subsequently succumbed to her addiction and died last year in December of 2022. She was so ill, I don't believe she could have done it on her own without at times being committed, however, very short periods of time. And then when she was in the hospital, they would release her at the most inopportune time, and she was back on the streets, many times her family not knowing where she was. And I just believe a similar law like Ricky's Law in Oregon is required.
Thanks for that painful call. Cynthia wrote into us to say, I do believe this would help and save many lives in Oregon if they could pass this law. I lost a brother to drugs, and I have a son addicted to drugs that I have no idea where his whereabouts are in Portland, but he's been in many rehab programs. Oregon needs to do something about this crisis, as it's a failed system currently, and so many people are suffering and dying for this horrible disease. And how about this one from Heather? We know that people mandated to inpatient substance abuse treatment actually have better outcomes than those who go voluntarily. The problem is beds. We don't have them. Laws do nothing if we have nowhere for people in crisis to go. That's an interesting point. And let's just pause here for a moment to address her points. When it comes to beds for addiction treatment, yes, Oregon simply does not have enough. You're absolutely right. We've been reporting on that for what feels like forever. But what about the assertion that forced treatment has better outcomes than voluntary for drug or alcohol? It's like so many other issues that we have in our communities here. It really does kind of depend on which studies you're looking at. We did some research, and if you go back in time, we found one report from the United States federal court system that was published in the summer of 1998. It looked at the role of the criminal justice system being the driver behind forced treatment. It reviewed 11 different published studies from the early 90s, and here's what it found. 5 of the studies found that forced treatment did, in fact, improve treatment outcomes. 4 found no difference between forced treatment or voluntary treatment, and 2 found that forced treatment actually made the outcomes worse. So, yeah, kind of a mixed bag there. How about this 2012 report in the Journal of Substance Abuse Treatment? That's a peer-reviewed medical journal. It found that people who are in court-ordered treatment have better completion rates compared to people who voluntarily seek treatment. And there's an explanation for that. The authors wrote, it could be reasoned that mandated offenders may begin treatment with low motivation, but are retained longer due to the threat of incarceration, which allows them to engage in treatment and provides them with the time needed to experience behavior change. Ricky's Law does not threaten jail time, but this is a study that people could point to say, you know what, forced treatment does work better than voluntary treatment. And finally, here's a study by the Recovery Research Institute, which is a nonprofit research arm of Massachusetts General Hospital. That's an affiliate of the Harvard Medical School. Their data was collected between 2005 and 2015. What did they find? They found it does not matter how someone gets treatment, forced or voluntary. They found no difference in substance use between more than 2,500 people, some who were forced into treatment, some who went voluntarily, and some who didn't go at all. So, once again, kind of depends on which study you want to believe to support your narrative. There are plenty of them out there when it comes to whether or not you should think Oregon should have a law like Ricky's Law. Some of you think it would be yet another state money pit. Others think it'd be a good idea. Howard wrote into us to say, an expensive waste of time. As soon as person get out of treatment that they don't want, they will go right back to drugs. Drug rehab treatment is great, but drug user has to want it. Problem is, there's not enough treatment beds available for users that want treatment. That is true. If you have thoughts on forced drug and alcohol treatment in the state of Oregon, or maybe you'd like to share a personal story, our inboxes are always open for you. Email us. The address is thestory@kgw.com, or call and leave a voicemail, 503-226-5090.